Assalamualaikum viewers and welcome back to our channel. Today in the playlist of pharmacology, our topic for today's lecture is the classification of cholinergic drug. So before discussing the classification, we first need to know about the cholinergic nervous system, cholinergic neurons of the parasympathetic nervous system. In that case, we will first study about the acetylcholine. Acetylcholine, it is a primary neurotransmitter that is released by the motor neuron at the neuromuscular junction to stimulate the contraction of skeletal muscle. But it is also a primary neurotransmitter of the parasympathetic nervous system. The effects of the parasympathetic nervous system or the activity of the acetylcholine at the neuromuscular junctions are following: the constriction of the pupil, secretion of the saliva, slowing down of the heartbeat, slowing down of the respiratory rate. It constricts the bronchi. It also causes the contraction of the stomach, stimulates the peristalsis, digestive juices, and the enzymes. It also contracts the bladder. So these were the effects of the parasympathetic nervous system, or we can simply say these are the effects manifested by the activity of the acetylcholine at the neuromuscular junction. So the cholinergic drug, they will mimic the same effects that were manifested as a result of the activity of the acetylcholine enzyme. So we have two types of cholinergic drug. The first are directly acting, that are the receptor agonist. They will bind with the receptor of the acetylcholine, and in return they will enhance the activity of the acetylcholine, and in turn they will be manifesting the effect similar to that of the parasympathetic nervous system. So the directly acting, that are the receptor agonists, are further subdivided into the two subcategories. First include the choline esters, which include the acetylcholine, bethnicol, carbachol, methacholine. You can also remember it by the mnemonic of MCAB. The other subcategory include the alkaloids, in which we have the following drugs known as the pilocarpine, muscarine, nicotine, ericoline, and lobeline. You can remember these drugs by the mnemonic PMLNA. Now we have the another class of the cholinergic drugs that are indirectly acting. Now they are the anticholinesterases. Basically, the cholinesterase, it is an enzyme that clears off the acetylcholine from the neuromuscular junction, which in return inhibit the activity of the acetylcholine. So these indirectly acting, that were the anticholinesterases, they inhibit the anticholinesterase enzyme by binding with it. Now this binding of these drugs with the acetylcholine can be reversible or irreversible. In the reversible categories, we have the carbonates, which are further subdivided into the tertiary amine and the quaternary amine. The tertiary amine, they are the lipid soluble, in which there are following drugs: physostigmine, ribostigmine, and galantamine. Galantamine is further subdivided into the acridine, which include the taurine, and we have also another donepezil present. In the quaternary amines, we have the water-soluble categories, including the neostigmine, the endophonium, and the pyridostigmine. You can remember it by the mnemonic of PEN. Now, the one that will be binding with the cholinesterase enzyme irreversibly, that category further involves the organophosphates and the carbamates. In the organophosphate, we have the following drugs that are present, which include the melantoin, paratine, serine, tabun, daflos, and ecothiophrates. So you can remember it by the mnemonic of PMDE. The other subcategory of the irreversible one are the carbamates, in which we have the carbaryl, propoxyl, LD-carb. You can remember it by the mnemonic of CAP. So it was all about the classification of cholinergic drug. I hope this video will be helpful for you all. Don't forget to subscribe to our channel for more videos and update, and also click on the bell icon so you will get notified about the future videos. Thank you.